Yeah, obviously behavioral change is something which is difficult to obtain because it really requires changing the habits, changing the incentives behind behavior, change the informations that people have, change the whole way in which decisions are made. However, there are a number of different initiatives that can be done. There are initiatives that can target the individual itself through better information. France has had very much of a success with a campaign with the antibiotiques c'est pas automatique, so that things that enter then into the understanding from the general public. There are things that can be done targeting more directly the professionals. So, all the issues of medical educations and continuing medical educations, there can be incentives put into the continuing medical education programs so that, doctors know what is appropriate use of antimicrobial and avoids excessive prescription of antimicrobials. Or they can be other type of mechanism that target more directly at global level, understanding where the infections come from. So much more surveillance systems, better monitoring of which type of bacteria give rise to resistance, and also having surveillance which happens in hospitals, but also outside the hospitals, in long-term care institutions, in other type of settings. And there can be obviously things in terms also of stewardship programs, which can be coupled also with financial incentives which are given to professionals. So there is a whole lot of different actions that can be done. It's a matter of becoming much more granular. It's a matter of also of sharing best practices much more. What works in one country can be also imported and used in some other countries. It's a matter of setting more clear targets and monitoring of those targets. What do we want to achieve at European level? Are we really on track to achieve those targets?